Pottery has been my hobby for about 20 years. I first realized something was wrong a few years ago. Making my figures became more and more difficult.
One thing that I love doing is just sitting down, relaxing, and going through our photograph albums of the family. And bit by bit, I began to realize that I was having problems telling who was who. I
had the earlier signs of macular degeneration.
There are two types of age-related macular degeneration. One is called the dry type, and the other one is the wet type. The dry type is the most common form of the disease. Unfortunately, the dry type, as of today, there is no effective treatment. The wet type is the most aggressive form of the disease, where if not treated effectively, patients can lose their vision quite rapidly.
Typical symptoms are worsening of the visual acuity, metamorphopsia, that means that straight lines are not straight anymore, they are waved. And in advanced stages, patients have also scotomas, that means central defects in their visual field.
Although I can see where I'm putting the brush, I can't see after I've done it what it looks like. And so I'm unable to paint properly, which meant virtually that I had to give it up.
I couldn't even tell my children from my grandchildren. And that started to worry me.
Even with the magnifier, I found it difficult to read newspaper print, especially any article which included long words. The end of words tends to disappear completely.
We started to implant a new generation of magnifying lenses, the macula lens.
The way the lens works is that it's like a magnifier in my eye, and I don't have to hold it in my hand.
It is a lens that can be implanted anytime after a cataract surgery. In case the patient has his own lens, it has to be combined with a cataract surgery.
It's quite a scary thought that somebody is going to operate on your eyes. But the clinic were fantastic, and there was real support, real encouragement. And the surgery itself, I have to say, was completely painless. I had to train my mind and my eyes to accept these new lenses. This involved reading text for about 20 minutes a day.
I must say it was very hard work, but guess what? I'm back making pottery again.
Vision is just so important to everyone, to everyday life. And if you think that your vision is starting to deteriorate, just don't waste time.